Good morning, everyone. My name is Choi from GemPharmatech. First of all, thank you all for taking the time out of your busy schedules to attend the seminar. Before we officially begin, please allow me to take a few minutes to introduce our company. So my first objective is to give you an idea of capability and the size of a company. Please feel free to interrupt me if you have any questions. So GemPharmatech is an international enterprise focusing on preclinical models and the research and development. And the corresponding test service is one of the world's largest mouse model repositories. So our team provides over 26,000 high quality preclinical models and model customization. So we are decided to providing you with a one step solution for biomedical research based on our world's largest collection of GMMS. The history of our company was grown from Model Animal Research Institute of Nanjing University, China in 2017. Our core research and development team and management team has over 20 years of experience in mouse model generation. And our company has been listed in mainland of China in 2022. Currently, we have 7 subsidiaries in both China and America. Here are our pictures from for the buildings of a company. Now, Dr. Han and I are working here in Nanjing. We have statistics of published articles based on our mouse models, and all these like kind of universities and pharmas are our important customers. Our logic of pipeline development is from models to preclinical services in these various therapeutic areas. Firstly, what kind of models that we can provide? Now, GemPharmatech is proud to launch the Knockout All project, KOAP, which aims to build a resource library of conditional knockout and knockout models for more than 22,000 of all protein coding genes in the mouse genome by using CRISPR-Cas9 technology. So basically, you can imagine it as a big supermarket of mouse model. You can find any kind of model that you need by enter the gene name or NCBI number from a website and then search for the model that you need. Moreover, we offer a wide range of gene-edited mouse models for specific therapeutic areas. For example, the immuno-oncology, spontaneous tumor, autoimmune, metabolic disease, neural disease, rare disease, etc. We also have different foundation strains with different components and features and applications. For example, we have a NCG and the next generation NCG immune system. NCG is our own immunodeficient mouse model. For your information, we just more than just only immunodeficient mouse model. We also have a next generation, which is a humanized immunodeficient mouse model. This kind of model have a human immune system reconstitution. So based on your research, so based on your research, you can choose the one that is a better model for your study design. Yeah, we can. Here is our human liver reconstitution NCG, which is a immunodeficient mouse model. This is a better model for study of a chronic liver disease such as NASH HBV, and it's a better model for drug PKPD studies. Yes, we can customize the models based on your requirements with years experience in CRISPR-Cas9, transgenic, and AD cell technology. So if you have any models interested but we do not have yet, no worries, we can always generate a new strain you need. So basically we can do the knockout, conditional knockout, knock in, point mutation, and the complex modification, and then the transgenic by using this various like genetic background. And the commonly mouse generative modification strategies that we used here are these. And currently we have completed about 29,000 models constructions with over 5,000 of conditional knockout models and over 8,000 knockout model annually. and the success rate is over 98.5%, which is extremely high. We provide customized breeding and preservation. We made a like acceleration since 2009, and our team, though not the company that time, built a ICLA system in 2014. Was one of the earliest team who get this. And after that, we built the platform. All our researchers are professional and well trained for the breeding. Next part is about our preclinical services. I'm just gonna skip it quickly. We can do the basically we can do the preclinical services in various therapeutic area such as oncology and immunology using our model resources. We can do this kind of services. And the next part is a metabolic disease platform and autoimmune disease platform. Last but not least is our neurodegenerative disease platform. We can provide many kinds of models, such as Alzheimer's disease, Parkinson, LAS, Huntington, etc. That's all I want to share for our company. So next step will be we are honored to have our Dr. Ham from our company to introduce our KOAP mice and some of their applications.
Okay. Good morning, everyone. So welcome to join our webinar for introduction of our company and also the resources related to oncology field. So I'm Bin Johan from GemPharmatech. So as you know, like the host already introduced, so we are expertised in providing genetic engineered mouse models. So my today's presentation will mainly focus on like the application part. So the first will be the introduction about the knockout top project. So from our name, so we can see that our aim is to generate all the knockout and flux conditional alleles for all the protein coding genes, like near 23,000 of them of the mouse genome. So in this process, we have become the largest genome engineered mouse model resources. So currently we have more than 11,000 knockouts, 10,000 flux, and 200 creates of our own independent property right. So the strains are majorly made on black 6J background, so which is more commonly used for genetic and related research and gene function studies. So we can see that now we have a total amount, like highest genome engineered mouse model amount all over the world compared with other major vendors. And to easily search through these resources, we have developed different engines, including the gene name search engine and also the gene family and signaling pathway search methodologies for our clients and collaborators to easily go through the related targets and the mouse resources condition of these targets. So here's an example about the AMPK and other pathways. And also for the combined application of the flux strains, we have developed more than 200 of query strains, and we have separated them by their tissue specificity in different organs or systems. And then we have developed a search engine for easy lookup of the tissue-specific query or query strains for the application. So we have validation data or paper supports for like more than 40% of these strains to make sure that they are efficient and specified enough for the study approach. We perform the validation using the like common way, using a flux reporter, which is faithfully represents the efficiency and also the tissue specificity of the query strain in the lifespan, since it goes through like a linear tracing method. So all the final consequence of the expression of the tissue specific query will be examined through all major organs and tissues of the mice. So firstly by PCR screening, and then the PCR positive tissues and organs will be subjected for further analysis, including fluorescence micrographs of fluorescence sections, immunofluorescence, flow cytometry. So here's an example about how we validate our own PDX1 query, which is considered like pancreatic specific query. So we use this reporter, which expresses the screen in ahead of cream-edited recombination and T-tomato after the recombination to indicate the activity and specificity of the Cre strain. So as a consequence, we can see that in the Cre positive strains, we can see the expression of T tomato fluorescence in the pancreas, but also some cells in the enterostomach and duodenum. Because this PDX1 promoter is expressed before the terminal differentiation of the pancreas, so this is reasonable that some of the other cells originated from the endoderm with the same stem cells or progenitors with the pancreas cells are also labeled. So, which means that this method faithfully, like represents the activity and specificity of this cray. Sorry. So, we have stored the majority of our strains in frozen sperm or embryos. So, for most of the like sperm or embryo strains, we need like 2 to 4 months to deliver the heterozygous mice, 3 to 5 of them. But we also have hundreds of strains stocked in live status. So for these kind of mice, we can have the delivery within 1 month to all over the world. So for the strains, and we have not completed for the development, we need to take the different timelines, like from 3 to 8 months to complete the development process. So for sperm, normally, if the strain we have already stored the sperm embryos, it will be the same for the live mice. But in other cases, we may need an additional month for the raise of the male mice and then the storage of the sperm and validation of its IVFs. So using the resources, so to the end of last year, so we have used our knockout flocks and crees to support publication, over 600 publications with a total impact factor over 7,800. So now, so the public, like the universities and our research facilities includes the top universities in China and some of the university or medical schools in North America and Europe. So in the second part, I want to specifically introduce some oncology-related genome engineered mouse models. So as we all know that, so different genes may be related to like tumor genesis and also like tumor therapy or anti-tumor immunology. So these targets like are separated in our knockout all project library. So it may be specific interest for different researchers, but also we have some common models like for spontaneous tumor and our xenograft and also anti-tumor therapy evaluations. So this part will be mainly focused like to these kind of models. So we know that there are oncogenes and tumor suppressors which contribute to the tumor genesis process in vivo. So we can mimic this kind of process by like expressing or suppressing the expression of these kind of genes and to to combine these kind of mutations to like generate spontaneous tumors in mice or facilitate this process. And then these models are suitable for some like chemical-based evaluation or some mechanism-related studies. For most of the cases, this expression of the mutated oncogenes should be conditional, since the constant expression of this gene during embryogenesis is usually lethal. So here's a summary of the spontaneous model resources in our facility. So we have different oncogene mutations, including KRAS, EGFR, and also other like APC and PMT. And also we have combined them with some like mutations of the tumor suppressing genes like P53 to enhance the tumor genesis process and also to give a better result. So let's briefly go through this data and see. So first, for lung cancer, it is one of the major health threats all over the world. And also the majority of lung cancers are non-small cell lung cancers, including adenocarcinoma, like squamous cell carcinoma, and large cell carcinoma. So the majority of the genetic mutation events in the NSCLC includes the mutation of KRAS and EGFR. So we developed this KS model by using a flex cassette to express the mutated KRAS G12C, which is a common oncogene driving mutation of the KRAS, so which can overexpress the mutated KRAS in a CRE-dependent manner. So after we combine this strain with the SFTPC promoter derived CRE, which is specifically expressed in 82 cells, it may lead to the development of spontaneous lung cancers. And also, in addition, we can also like to express a mutated to conditionally spontaneously express a conditional version of mutated P53, which is the R172H. Together, this oncogene driver and the mutated tumor suppressing gene can facilitate the process of the generation of spontaneous tumor, and also it is suitable for study related to P53 mutation. So we can go through this and see that the KPS strain also have a more severe phenotype, and also the survival is a little bit worse compared with the KS model alone itself, and also the tumor is stronger compared with the KS model. So the detected point of KPS model of the lung tumor cells is 2 weeks earlier compared to the KS model, and also the incidence of tumor is nearly 100%. And also, in these two models, the nuclear staining was considered positive for TTF1. So this is the spontaneous model with the highest consistent with the human disease of lung adenocarcinoma. So other than the common G12C mutation, the G12D mutation is also nearly as popular as the G12C mutation driver. So we can also develop this model based on LSL conditionally expressed G12D overexpression model. And also this model can be combined also with the SFTPC CRE, and also we can combine this with the LYZ2 CRE. Although LYZ2 CRE is majorly considered as a immune cell or myeloid specific CRE for immunology related research, it is also specifically expressed in lung 82 cells. So we can see that in this G12D model conditionally expressed, and the detected point of the tumors can be as early as 6 weeks old, and also with nearly a full incidence of the development of this tumor. And this model would develop myeloma and lymphoma about 16 weeks later than the incidence of the lung cancer because of the CRE expression in the myeloid cells. And also, in this model, the myeloma or lymphoma cells have a higher degree of malignancy and can be infiltrated into lung, spleen, and lymph node, so which is suitable for some tumor infiltration and also tumor invasion related research. So the other kind of mutations, though there are various mutations of EGFR, which is another major oncogene majorly in lung cancer. So we have developed different mutation types of the EGFR, including combined point mutations, exon deletions, etc. So these models are very suitable for studies about the resistance of the EGFR inhibitors, and to see if the new therapy can get rid of this EGFR resistance and is suitable for the drug evaluation. And these mice, other than the combination of CRE strains, they can also be used by infection by AAV6 CRE, which is specifically delivered into the lung cells. But however, if for the combined expression, these strains can also be used with SFTPC CRE-ER for the different purposes. So let's take this triple mutation strain as an example, which is conditionally expressed after CRE-mediated recombination, and it itself is driven by ubiquitous promoters, so we need to use a tissue-specific CRE strain or tissue-specific CRE delivery method like the AAV6 adenovirus for the tissue-specific expression. So also, other than the EGFR and KRAS, we have different like knockout models for the other kinds of tumor studies. So including the traditional like TSC1 or TSC2 conditional knockout. So it is suitable for like epithelial myomatosis and other kind of tumors depending on the query we use. And also the mutation of STK11 is the Peutz-Jeghers syndrome, and also mutations or knockouts of different genes, including SERPINA3, BRAF, NRAS, and CCL2, can be like representing the models for different cancer-related rare diseases, including the Etienne-Kester syndrome, and also the tumorigenesis driven by some like minor genes or uncommon genes. And also the mutation of F1 and F2 is can be used for neurofibromatosis analysis. So we know that there are many like tumor genesis related targets and mutations. So normally we can choose to like combine some of the spontaneous models with some of the genes knockout or other kind of mutations to like do some of the mechanism or function studies. Also, other than the spontaneous model, we can also commonly use xenograft models, including the syngeneic models, which means that we transplant the tumor cells of mice into the other mice and to see the tumor growth and other researches. And also we can do like human cell derived xenograft or patient derived xenografts on immunodeficient models, including the severe immunodeficient NCG models or SG, NOG models, and other kind of immunodeficient mice, including the nude mice or skin mice, to grow the tumor. And then based on this, we can use different drugs to evaluate their anti-tumor efficacy. So the first, for syngeneic models, we have developed multiple gene-humanized mouse. So as shown here, and we can combine them to like double, triple, or even quadruple targets. And then we have made the strings of the popular targets on both backgrounds, like the black 6 and BALB6 backgrounds. So these backgrounds are suitable for syngeneic models of different tumor cell lines, and also themselves they have like differences, like the activation of the immune cells. So let's take the evaluation of triglolimab as an example. Although not some of the pharma companies have give up the development of TIGIT related drugs, but however, like this target have shown great potential, and I think some days it will like raise again for the drug development. So then we can see that if we use a PD-1 and TIGIT combined therapy, and for the like colorectal cancer syngeneic models, we can see the significant tumor growth inhibition in the BALB6 background model, rather than the B6 background model when xenographed by MC38. So what's the potential reason for this? So we have like studied the tumor infiltrated leukocytes of both these two models, and we can see that the infiltrated percentage of NK cells is dramatically higher in BALB6 cells after the analog treatment, and also the Treg level is decreased. However, like this effect is not observed in a black 6 base background, and also the Treg infiltration percentage is increased. So which means that there's different like basic immunology patterns of these different models. So sometimes for like anti-tumor related drug screening, maybe BALB6 can give like a better result. And also the second case, when we studied like the toxicity or the side effects of these drugs, so we use these anti-CTLA4 drugs for the combined therapy research. We have already know that there's like clinical outcomes like joint swelling and skin inflammation in patients. And after we deliver these drugs to different backgrounds, so this kind of phenotype is not observed in the black 6 background, but it is observed in the BALB6 background after the combo treatment. So which means that it mimics like the oncology mechanism of human more compared with the black 6 background, and also like the autoimmune the the natural immunity or the non-adaptive immunity is hyperactive or more active in the black RBC background compared to the black 6 background. And also, as I already mentioned, so the severe immunodeficient models like the NOG, NSG, and NCG is suitable for the xenograft-based analysis. I think most of you are very familiar with this kind of field. However, based on this, we have developed multiple next-generation NCGs for humanization of different cytokines or differentiation-related factors, or like NH or like GVHD inhibitors to facilitate the process of immune cell reconstitution, including the PBMC reconstitution and hematopoietic stem cell reconstitution for specific, populations. So let's take that NK cell related interleukin 15 as an example. So if we apply this strain, so it can largely support the differentiation of human NK cells from the HSC transplantation and reconstitution. So it's more suitable for the NK cell based therapies. And not only for the support of NK cell differentiation, and also this can support the maintenance of NK cells and thus the efficacy study of CAR NK research. So this is the data and the resources I want to share today. Thank you for your attendance, and your questions are warmly welcomed. Thank you.